Hello, I'm Dr. Stephen Blomerth. Welcome to Natural Health Today. This show is a show about your concerns, the things that may bother you or a friend or loved one. And what we do is we talk about natural ways to help you get better. Because in my 37 years of practice, I've learned that probably 80 to 90% of the day-to-day run-of-the-mill things that people take to their medical doctor and seek some help, most of those problems don't require drugs and don't require surgery. They can be helped by natural means. And when I talk about natural means, I think of four basic avenues that we follow. One is manipulation of joints that are stuck. In other words, if a joint is stuck anywhere in your body, whether it's your neck, your back, your feet, your knees, your hands, that joint just will not only not move well, but it'll also cause problems in the entire area. It could be a problem of stiffness, could be a problem of pain. Another way that we help people by natural means is by muscle work. And I'm not talking about just massage for a person. I'm talking about finding special knots, special tight spots, special what we call trigger points that can not only trigger a point but also pain, but also limit the amount of motion that you have and have some far-reaching consequences, because there are bands of these fibers that run from your foot all the way up to the top of your head by your neck. So making sure that you don't have those trigger points and treating with hands-on techniques, that's a very important part of what I call natural health care. The third means of helping people is by exercise. And exercise is not, for me, working out in a gym, because most gyms tend to concentrate on exercises for areas that are already too strong, already too tight, and most of us don't need to be any stronger unless we're going to be in an Ironman competition or weightlifting or body sculpting. We just want to be stable, and for stabilization, the best exercises are something that I ran into about 7 years ago called foundation training. These foundation training stabilization exercises are probably the best thing you can do, far better than going to a gym. And the last avenue of natural health care I think of is probably one of the most long-term, the most powerful, is nutrition. And nutrition to me is a lot more than eating 3 square meals a day or looking up the various food pyramids that you'll see. Eating right is more than just eating in an organic fashion. You don't necessarily have to eat in an organic fashion. It helps, but you can get by without it. I'm talking about eating a diet that's high in fat, moderate in protein, and low in carbohydrates, and choosing carbohydrates that are not high glycemic. All these things help you avoid being overweight, avoid inflammation, and avoid things like diabetes. So what we do is we have you send in your questions, and we talk about the natural health means that can help you. And if your problem is something that is beyond natural health care, we'll also tell you that too. So one of the means that you have participating in this show is send your question into pbdchiropractic@gmail.com. We'll use your question. We'll disguise your name a little bit so your friends and neighbors won't know what the problem is that you're writing in about. Or you can telephone my office. And my office phone number is 978-535-6155, and we can take your question in that way. You can even send an old-fashioned snail mail handwritten letter to my office address, which is 215 Newbury Street, Suite 102, Peabody, Massachusetts 01960. Whichever way you choose to participate in the show, we'll talk about natural health means for you to help yourself or get the proper help to get better for yourself or somebody in your family or a friend. So, with that all said, let me put on my reading glasses and have a look at some of the questions that have come in since our last episode. Okay, Diane writes in from West Peabody. She says, I was told I had a slip disc in my back about 10 years ago. The surgeon didn't recommend an operation and the pain went away. But about 2 weeks ago, I got pain in my back again. Do you think that I got another slip disc? Yeah, Diane, without examining you and seeing what your symptoms are like, It's hard to say. A slipped disc can and usually does heal itself. Slip discs sort of have a sort of natural progression, a history. About 2 years is what it takes for a slip disc to heal up on its own if nothing is done. And as you get older, it becomes less and less likely that a disc will slip. As we get into our 60s and 70s, you'll find that the disc is a bit like a tube of toothpaste. A tube of toothpaste, if it sits around for long enough, rather than being able to squeeze the toothpaste out of the tube, it dries up and it won't shoot out. So that disc isn't able to slip out, because the disc material is about the consistency of toothpaste. It's kind of thick and gooey. It's not a solid, it's not a liquid, it's kind of in between. It's fairly thick. As you get older, it won't squeeze out. So could you have another problem giving you pain in your back? Yeah, there's many other problems that can give you pain in your back. Some are serious, most of them aren't. When people get worried about the pain in their back, the percentage of problems that are discs are probably 1%. The percentage of problems that are more serious, like cancer and tumors, are less than 1%, far less than 1%. They're percentage of a single percent. The overwhelming majority of day-to-day back pain problems are simple mechanical problems. Simple in the sense of they're not caused by pathology. Doesn't mean they're simple to get rid of, because what we talked about before, your joints, your muscles, your imbalances and trigger points that people have, that can be very hard to get over too. So just from your description, you had a slip disc 10 years ago. Is it the same disc? That's pretty unlikely, but if you have a tendency towards having slip disc, could be another. As you get older, the incidence of disc problems is less. I'd say the best thing is not to take your problem first to a surgeon or an internist, because you'll get prednisone, cortisone shots, and you probably won't get better as quickly as you would if you had some simple, basic, natural health care like we provide. So, Diane, thanks for that question. Let's go on to our next question. Rich writes in from Danvers. He says, my wife tells me that I walk funny lately with my feet pointed out more. I can't tell, but I know I've had more pain in my butt lately, even though I go to the gym 3 days a week. If I'm walking differently, would that hurt my butt? Well, you know, when people walk differently, there's usually a reason, and the reason can come about usually very slowly. So Rich says that his wife has noticed that he's walking differently, and so that toe out, you know, position like that, that's an unhealthy situation to walk around like. Some people can't help it because they're born that way. Some people's hips just have a certain position where they don't sit right in the hip joint unless the feet are turned out. But with the feet turned out like that, that doesn't sit very well in the hip joint at all. If your feet are more like this, straight ahead, with the outside edges parallel, that sits better in your hip socket. So then we'd have to ask, well, why is Rich walking with his feet more turned out like that? Why is he turned out like that? It could be from the exercises he's doing at the gym. There are some exercises wherein you push out on a particular bench. They have something you push out, and that pushing out, that external rotation, that strengthens a muscle that is in your butt. In fact, it's underneath your glute max. It's underneath your butt muscle. That muscle called the piriformis. The sciatic nerve runs 3 different ways, either on top of it, underneath it, or right through that muscle. If that muscle is over tight, yeah, you'll have pain in your butt. And if you've been doing exercises at the gym to strengthen that muscle, of course you didn't know it. People just said, do this exercise. People don't know why many times they do an exercise. They just do it because it's part of the gym protocol, part of the little circuit they're on. If you find that cutting down on that exercise helps you have less pain in the butt, and if your wife starts to notice your feet aren't quite so turned out, then that will say that that was a good guess, that it was the piriformis. I think it would be very helpful for you to be examined by a doctor who knows where to look for the piriformis. Do some muscle work on that piriformis to calm some of the over-tightness. Stop doing that exercise and see how your feet look and see if your pain goes away. Rich, that's probably the best solution. You know, sometimes our wives are right, so let's leave it at that. So thanks for that question, Rich. Our next question is from Pat. I can't tell whether Pat is a man or a woman, but we'll just call this person Pat. Writes in from Middleton. I have a funny thing that happens to me after I eat. It doesn't happen after every meal, mainly after eating fried food. It bothers my stomach a little, but mainly my right shoulder blade area. Then the pain goes away after a few hours. Have you ever heard of that? Is there something I can do about it? Okay, so what Pat says is they have a meal, and this person says it's not every meal, but it's particularly after eating fried food. Bothers the stomach a little bit, but it really hurts up over the right shoulder. So what can bring out pain into the right shoulder blade from a meal? And it does sound a little funny, but that's very common with people who have a gallbladder problem. Gallbladders, when they hurt, yes, they can hurt. Gallbladder actually is up under your liver. Your liver is on the right side, so if you put your hand on your ribs, go down to the end of your ribs and kind of go up underneath, that's where your liver is, and your gallbladder is in deep to that. So if your gallbladder has a spasm, it's not always felt right in through here. Could be, it might not be. It might be felt up over the right shoulder blade and down over the back of the wing bone, your scapula. It sounds very much like it is a gallbladder problem. Is that a problem you need to take to your medical doctor? Well, if you've had it for a while, it's probably not a bad idea to have your gallbladder checked out. Can you do anything about it that's natural? Well, you can try taking some bile salts. What your gallbladder does, it makes something called bile. And bile is what helps you digest fats. People say, well, I don't want to digest fats. You know, just leave them alone. Well, if you don't digest fats, you won't be able to absorb vitamin A. You won't be able to absorb vitamin D. You won't be able to absorb vitamin E. You won't be able to absorb vitamin F, and you won't be able to absorb vitamin K. So there's a lot of good reasons to absorb and handle and properly digest fats when you eat them. And the signal to me that you had a gallbladder problem, which is it didn't happen all the time, but particularly after fried foods. A fried food meal, of course, is going to be high in fat. Doesn't mean it's necessarily bad, but what it says is it's making your gallbladder work even harder, because your intestines, they detect the presence of fat and how much fat is in there, and it makes the gallbladder have to work harder. If the gallbladder is having a problem and has to work harder, then it'll go into spasm and give you pain. And that pain, again, might be felt here, might be felt up over the shoulder blade. Taking some bile salts might help you have your gallbladder work a little bit less hard, because it's getting some help. The bile salts are something that are not bad for you to take. Will it make the gallbladder problem go away? It may not, but it may make it manageable. Do you want to have your gallbladder out? Well, it's a less painful surgery than it used to be. But once you have your gallbladder out, all those fats that we were talking about, you just don't absorb them as well. So you're not going to absorb vitamin A, D, F, and K, and those are pretty crucial vitamins to stay healthy. So just to be safe, get your gallbladder checked out, take some bile salts, and see if you can't manage your problem for a while. If it needs to be surgically removed, fine, but remember it'll be a good idea to take some bile salts either before and certainly after you've had your gallbladder out, because you're not going to make the same amount of bile that you did beforehand. But thanks, that was a good question. Okay, Pam writes in from Danvers. She says, my husband and I run a restaurant and we are really busy in the summer. I'm on my feet for about 12 hours a day and it hurts my feet and my back. I tried some back savers from the drugstore, but it didn't help much. I remember I had a problem as a kid with my feet and my back. Then it went away. Can flat feet come back on you after you grow up? Yes. Flat feet can come back on you, and here's the real truth. Flat feet never go away. It's just that our perception of the pain may go away. We may become more stable and not need as much help. But if you have flat feet as a kid and your pain went away, your problem didn't go away, your pain went away. So Pam says she's on her feet a lot, 12 hours a day. It's very understandable to have pain in her feet. What she was talking about was going to the drugstore and buying what she called some back savers. In other words, they go inside her shoes and they try to help support your arch. Without looking at Pam's feet, I can't tell whether she's flat-footed enough, but some people are so flat-footed that something made in a factory to a mold that wasn't Pam's foot, you can't tell whether that's going to provide her with enough stability and support for her arch. Because the arch of the foot doesn't just affect the foot itself, it affects how the shin rolls in, how the thigh rolls in, how the hip joint rolls in. I find many patients in my office are helped by having custom-made orthotics. In other words, we take an impression of the foot. With that cast, we make a mold to make something that fits the foot far more exactly than just buying it stamped out in a factory. That's going to be a simple thing to try. It's certainly less invasive than having drugs and surgery. Try that. If the store-bought ones at the drugstore help a little bit, it's a good indication that something made to impression of your own foot will help even more. But Pam, thanks for that question. Remember, you don't outgrow your flat feet. You may not have the pain anymore, but from the age of 2, your feet either have the arch that it was supposed to form or they don't, and it doesn't come back. Pam, thanks for that question. We're going to go on to our next question. Dave writes in from Danvers. He says, I get neck pain every day. Is that a sign of arthritis? I'm only 30 years old. Isn't that too young to get arthritis? It's not too young to get arthritis. I've seen patients who was 22 have arthritis in her back. So you can have arthritis in your back at any age. It's not something dependent upon age. It's dependent upon more wear and tear. As we get older and we've lived longer years and we have many decades in our life, that wear and tear does add up. And it's rare to see somebody who's in their 70s and 80s without quite a bit of arthritis. Does it mean you have to have pain? It doesn't mean you have to have pain. It just means you're living and working on planet Earth with gravity, stresses, stressors, and activities. These are what makes bones and joints wear out. How can you maximize the wear and tear or minimize the wear and tear? Well, keeping weight down, getting exercise on a regular basis, eating good foods, getting care from time to time to help free up those joints as much as they can. Sometimes a person can have advanced arthritis, but they've had care enough in their life so that the joints still move relatively well. The trigger points and the muscle imbalances and the different muscles in their spine, their neck, their back, and all over have been attended to so they never get to the point where they feel tremendous pain. And that can go a long way to making your neck, your back, any joint in your body last longer. Does arthritis come out in a 30-year-old? It can. It depends on what you've done. Is your neck pain only due to arthritis? Well, unless you've had x-rays of your spine to see, you don't know. Just having pain in the neck or pain in the back doesn't mean you have arthritis, because there are many, many causes that can give you a pain in your neck and pain in your back. Arthritis is just one of them. It's a fairly common cause. It doesn't mean you have to have it, and also it doesn't mean you can't be treated, you can't be helped, you can't have a comfortable life if you do the right things. So we've come to about the end of our time and our questions now, so I'd just like to thank you for watching Natural Health Today. Remember, you can participate in the show just as today's people did. If you send your questions in to pbdchiropractic@gmail.com, or if you telephone my office at 978-535-6155, or if you send even an old-fashioned snail mail handwritten letter to my office address, which is 215 Newbury Street, Suite 102, Peabody, Massachusetts, 01960. Whichever way you decide to participate, we'll read your question, we'll disguise your name, we'll talk about different simple ways you can help yourself. And if you can't be helped by natural means, like the woman who had the gallbladder problem, well, at least we gave you some idea of where to look to get some help, so you get the best care possible that you can. So thanks again. I'm Dr. Stephen Blomerth. Thanks for watching Natural Health Today. I'll see you next time. Bye-bye.